Cord blood banking, saving lives one donation at a time. 70%. That is the number of patients that do not have a match and their families if a stem cell transplant is needed, according to the National Bone Marrow Program website. What would you do? What would you do if someone you love needed a stem cell transplant or bone marrow transplant but aren't a match? Many are faced with this heartache every day, but what if I told you that didn't have to be the case? Cord blood banking has the potential to save not only your child or family member, but also a stranger's life. According to BeTheMatch.org website, 148 people a day die from blood cancer. A cure is needed, and cord blood banking enables for the research to continue. More people need to become aware of the benefits of cord banking and the potential life-saving abilities that it has. Becoming educated before giving birth is essential to preserving your baby's cord blood. To understand the benefits of cord banking, we must first understand what it is. The blood left in the umbilical cord is called cord blood. Once the umbilical cord is cut, a needle is inserted to withdraw the blood. This blood contains red and white blood cells and stem cells, similar to the ones found in bone marrow. According to the WNDU.com website, because these blood cells are less mature than adults, they are less likely to be rejected. Most pregnant women are still unaware of what cord banking is and the benefits that it holds. According to the NBC News website, 90% of cord blood is discarded every day. This high number suggests that pregnant mothers are simply uneducated about the possibilities and are not given the option to bank the cord blood, whether private or publicly. Because of the possibility of using your child's own cord blood is small, NBC News website suggests donating the cord blood to a public bank to make sure that the cord blood is used for donation. Those that are educated about the effects of cord banking are scared away by the cost of it. Private banks oftentimes charge a large upfront fee and then a yearly fee to keep your blood. Most are hesitant because of the expense, but what they don't know is that most are willing to waive the cost if there's a family member in dire need. Even if finances are an issue and the cost outweighs the need of a personal cord blood banking, there's a greater need of donors to help those that could benefit from your baby's cord blood. The cost to donate into a public bank is free. There's a lack of donation because these cord blood banks are not always available in your area, and that can be discouraging. Much like organ donation, the first step is to be informed about your choices, and the next step is to find out how to do it. Whether the choice is private or public banking, being informed on the process is important and timely. According to cordblood.com, CBR is the largest stem cell registry for newborns in the world. It banks over 500,000 stem cell samples and provides instructions on how to private bank cord blood on their website. Pregnant mothers first must submit paperwork to their obstetrician at least 3 months before the due date. The process is simple. You enroll on the phone or over the internet. An information kit is mailed and filled out, set aside for the big day. At the hospital, the kit is given to personnel, and after the birth, a medical courier is called to collect the sample. Simple and hassle-free, but it comes with a fee. Be the Match Registry, as stated on their website, is the largest non-profit donor registry in the world with over 680,000 cord blood samples worldwide. As the same with private banking, pregnant mothers must notify their doctor prior to giving birth of their intended donations, and patients must meet specific donation guidelines according to their website. Once guidelines are met, it is necessary to check hospitals for those that collect cord blood for public cord blood banks. If none is available, a simple option as like private banking is available, where a collection kit will be mailed and filled out and secured at the hospital following the birth. Once donation is received by the bank, it is tested and secured in the registry for the patient in need of transplant. According to PR Inside website, cord blood has become the primary resource for stem cells over the last 10 years, making it in high demand. With a large amount of research and transplants taking place, there's a high demand for cord blood samples. According to care.com, cord blood is used for regenerative medicine, and that it uses the body's own cord blood to restore first lost and destroyed tissues and cells. Cord blood is currently being used in several clinical trials, including hearing loss, autism, cerebral palsy, and type 1 diabetes. Along with clinical trials, there are also research studies, including brain injuries, in utero stroke, ear drownings, along with many more. Along with regenerative medicine, it is also used for stem cell transplants. Stem cells transplants have been used in connection with several forms of leukemia, sickle cell, and many more life-threatening diseases. Care.com says new research is evolving that may include treatment for spinal cord injuries, Alzheimer's, heart repair, and many more. With all of the life-saving abilities the cord blood provides, this choice should be an easy one. Even though the chances that your child will ever need to utilize its own cord blood is small, the facts have proven that by donating it for transplant and research, lives are being saved and possibilities are endless. If you are pregnant or thinking of becoming pregnant, consider what just those few ounces of blood could do to save someone else's life. Take the time and donate your baby's cord blood. 97%. According to the bethematch.org, that is the likelihood that a match will be found on the registry of a patient looking for a donor. A 97% chance a life could be saved by donating.
Edward. Kristen Downer.